The number of newly confirmed COVID-19 cases in South Korea has been on an upward trend, with Monday's tally the highest for a Monday in 6 weeks. One aspect that is worrying for authorities is that while cases are on the rise, they are not due to new variants of concern, the so-called BQ.1 and BQ.1-point-1 strains. These new variants were found in less than 1% of samples looked at. To dig deeper into the situation, we have Professor Howard Lee from the Department of Molecular Medicine and Biopharmaceutical Sciences at Seoul National University. Always good to see you, Professor.
Thank you for having me back. Good morning.
South Korea saw its COVID-19 cases rise, as I said, in recent weeks. However, it doesn't seem to be because of newly discovered variants, which seem to be more transmissible. Do you think cases will rise even faster once these new variants spread around the country?
The BA.5 is still the major variant in South Korea, comprising more than 90% of all the variants. The new variants, such as BQ.1 and BQ.1.1, as you said earlier, account for only 1% at this moment. These variants are also a child variant of BA.5, although they are known to be more immune-evading. I don't have a crystal ball in front of me right now, so it is hard to predict exactly what we'll see in coming months. That said, however, if we look at the recent COVID-19 statistics in the UK, US, and Germany as well, where the BQ.1 variant makes up 20, 14, and 5% respectively, there has been no dramatic increase in COVID-19 cases with the new variants spreading out. If those observations in other countries are anything that we can go by, I don't think there will be a skyrocketing increase in South Korea soon, even though the new variants are spreading around the country.
Right, and the head of nation's health authorities yesterday said they're on high alert because of the fatality rate, which has risen from 0.06% to 0.09%. At what point is the level perceived as being dangerous or alarming?
Well, in Korea, the case fatality rate has been maintained very low, under 0.1% since early this year. So although the change from 0.06 to 0.09 is a 50% increase, it is still very low, below 0.1%. I would say we might have a serious situation if the case fatality rate is above 0.2% or 2 out of 1,000 infected people die. I think the main reason for the apparently rather high increase in case fatality rate was because there have been many undetected cases in the community, contributing to the lower denominator, while deaths are hard not to be detected. Of course, the new variants and low booster vaccination rates, particularly in the elderly and populations at risk, could have contributed to the increase too.
Right, and the country has let go of many of its prevention measures that had been in place. Is this okay, or will this backfire come December when viruses spread more quickly under cold weather conditions?
Well, that's a million-dollar question. The strict prevention measures in the past, such as social distancing, outdoor face mask wearing, and pre- and post-entry testing, have all been lifted. I don't think we can go back to the past. People are tired, and they won't cooperate with the government as much as they used to. Therefore, this may not be okay to some, but pretty much practically tolerable to me. In fact, the most recent resurgence we experienced went by without strict measures implemented, and many now have antibodies, either because of vaccination or because of prior infection. In addition, we have vaccines including the newly developed bivalent ones. Vaccines are still useful to prevent infected patients from becoming seriously ill or even dying. Putting everything together, I think this winter is more likely to be different from the ones we had a year ago or before.
Well, thank you so much for your insight, as always, and I hope you have a great day, Professor.
You too, sir. Thank you.